Hello guys, now we shall be discussing about another parasite, that is Cystoisospora belli, right? So we shall be discussing about Cystoisospora belli. Now what are the important things you need to know about this Cystoisospora belli? So the first important thing is that this Cystoisospora belli is responsible to cause transient diarrhea. It is responsible to cause what? Transient diarrhea. Now the question is that transient diarrhea in which group of patients? Obviously it would cause transient diarrhea in AIDS. Okay, some of the parasites cause transient diarrhea in normal individuals and heavy diarrhea in immunocompromised. Some of them cause heavy diarrhea in AIDS patients. I mean, AIDS is an immunocompromised state, obviously. So AIDS or the immunocompromised patients, both of them are the same. In the context, whenever they give you AIDS patient or immunocompromised patient, so both of them are the same. Okay, so some of the diseases, some of the parasites in the normal human beings, they cause heavy diarrhea. In AIDS patients, they cause transient diarrhea. Whereas some parasites in normal people cause transient diarrhea, whereas in AIDS or immunocompromised patients, it causes heavy diarrhea. So we shall list out all of them and write those important points. But right now, Cystospora, normally in AIDS or immunocompromised state, the diarrhea has to be heavy. But now here it is transient diarrhea. Another important thing is that regarding the transmission, of this parasite, how it is getting transmitted. So it transmits when you ingest the oocyst of this parasite. So can I write it as oocyst ingestion? Oocyst ingestion. And how are you going to ingest this oocyst? Fecal oral transmission. Fecal oral transmission. Fecal oral transmission. Fine. Now, how will I diagnose such cases? How will I diagnose such cases? Now, what do I do is that, first of all, I do a stool test. Now, within the stool test, I'll take the sample of stool. Okay, within the stool test, I will find acid-fast elliptical shaped oocyst. Okay, so what will I find in the stool sample? I would find acid-fast elliptical shaped. How many? Two elliptical shaped oocyst. Two elliptical shaped oocyst. Now, for example, let me draw it. Now, this is called as an elliptical shape. Okay, so what is this shape called? This is called as an elliptical shape. Now, in this elliptical shape, you would find two more important things, that these two, like this, are called as porocysts. So this picture which I have drew here, this is called as an oocyst. So this is called as an oocyst. Now within this oocyst, right, this is an elliptical shaped oocyst. I have only drawn one, but there are actually two. Second important thing is that within this oocyst, whatever these green color oval bodies which I have drawn, right, these green color oval bodies, they are called as porocyst. Now how many sporocysts are there? We have got two sporocysts. Adding upon that, within these sporocysts, I have got four structures, 1, 2, 3 as well as 4. Okay, here also 1, 2, 3 as well as 4. So I've got 4 structures within each sporocyst, and these structures are called as trophozoites. These structures are called as trophozoites. How many trophozoites are there? There are 4 trophozoites in each of them. completely 8 trophozoites, right? Now, what I'm trying to tell you is that in the stool sample, you would find an acid-fast 2 elliptical shaped oocyst, right? Containing 2 sporocysts, each with 4 trophozoites, each with 4 trophozoites. So this is a characteristic finding which you'll find in case of Cystoisospora belli. So if they want to ask you a question regarding this parasite, definitely guys, they will ask you a question on this. So they will tell you that a patient is having so and so symptoms, right? So they'll be giving you all the symptoms there, and finally they'll tell you that during the diagnosis, I mean after this, when we have examined the stool sample, we have found such presentation like we have got 2 elliptical shaped oocysts. In each of them, we have got two sporocysts in each of these oocysts, and within each of this sporocyst, we have got 4 trophozoites. So this is how they're gonna mention it. Okay. So depending upon how many trophozoites are mentioned, the parasite differs. So for this parasite, it is 2 elliptical bodies, 2 sporocysts, and each sporocyst is containing 4 trophozoites. Right. This is the important thing to remember. Now, what will be the treatment part? When it comes to the treatment part, obviously the treatment which you will be giving in this patient is trimethoprim, sulfamethoxazole, or simply you can write it as TMP-SMX. Okay. The second important treatment is pyrimethamine. The second important treatment which you can give is pyrimethamine, right? Right. So this is a stool sample here. Now within this stool sample, you can see an elliptical body over here, right? So I mean, this is not that clear, but anyways, you have got 2 elliptical bodies. So this is how it looks. This is the exact feature how it looks regarding Cystoisospora belli. So these are all the important things which you need to know. So this is it. Thank you so much for watching my video. Goodbye.